Excellent. Well, we're going to give folks a little time to join in, and we just want to share appreciation for so many people being here today to learn about how to become an ambassador. And welcome back if you've already been trained and you're just here to get a brush up, because there's so much happening in this world. It's a good time to get back caught up. Just to say a thank you. We know this is showing your commitment to your community and to the health and wellness of everybody in your community, your families and your neighbors as well. I'm going to introduce myself to you. My name is Cindy Chavez. I'm a member of the Board of Supervisors, and I want to talk just a little bit about what we're going to be doing today. I'm joined by various leaders here, and we're asking you, our trusted leaders, who are really well connected to your communities, to help us make a difference in our COVID-19 response. So the whole goal of this program is to train you to be able to address misinformation by becoming a certified source of up-to-date COVID-19 information for your communities. We're going to learn about 4 major topics today. COVID-19, just kind of 101, testing, COVID-19 testing, COVID-19 vaccination, and then COVID-19 communication. My hope is that when you leave the training, you'll feel good and confident about the answers you have for your community and family and friends related to COVID-19. Before we continue, I want to ask my staff to put a brief poll up on the screen. If they could pop that poll up. And what we're asking is, how did you learn about training? We're just curious about always how to improve the program. And so part of this is getting that information, so folks could log in and give us that, that feedback. And then you'll see we have another question, which is around what's your most used social media platform? We're curious about how you communicate with the world. And we're also curious about what you think you understand about COVID-19. And part of the reason we're doing this is we want to look and see at the end of our presentation, we'll ask you a couple of these basic questions so that we can better understand the effectiveness of the training that we're doing. And just so you know, we're recording this this program, and the reason we're recording it is that if you want to listen to it later, or you want to make it accessible to folks in your community, that you're able to do that relatively easily. And I'm really excited that we have a couple of community leaders here. While you're voting, I'm going to go ahead and start introducing who's going to be speaking to you next. I see we have 73% of you have already voted. So we're going to see if we can get the rest of you to vote. And I can see that we have nobody using Viber. And I don't know if that's because, like you, like me, you don't know what that is. So we'll see. we'll learn more. I'm sure the youngest person in my office put that poll there together. But I'm really excited that we have a couple of community leaders who've stepped up to the plate, who are taking responsibility for leading our ambassador program. And I want to introduce Jake Tonkel. Jake is an activist in San Jose and a former candidate for city council. And we're so excited that he's staying engaged and involved with our community, and an active member of the environmental movement as well. And also the mayor of Mountain View, Ellen Kamei. And I want to let them talk to you a little bit about the roles and responsibilities of the ambassador program. And so I will stop voting for a moment just to take a look at what our results are. We see that most of you learned about this through email and social media and family and friends. That's great. And then let's look at your social media platforms, see what those are. Facebook was #1, Instagram 2, Twitter 3, TikTok, WeChat, Line, and WhatsApp and other. And then we see that we've got a lot of you are intermediate knowledge of COVID-19, which is great, and some advanced and some basic, or we're going to see if we can move all those numbers up just a bit. So with that, I'm going to reintroduce Jake and our Mayor Kamei, and I'm so excited to have them both here.
Great, thanks so much, Supervisor Chavez. Hello, everyone. My name is Ellen Kamei. I'm mayor for the city of Mountain View.
My name's Jake Tonkel, former candidate for San Jose City Council, and just honored to be up here with Mayor Kamei. Don't know how I got tapped for this, but excited to be here and excited to help.
Thanks so much, Jake. It's exciting to be able to tag team this with you. So we're here today to ask you for your help and your leadership.
As we know, COVID-19 cases and hospitalizations continue to rise. Our ICU capacity is continuing to stretch itself pretty thin as well.
So the county's Emergency Operations Center, Dr. Sarah Cody, and the Public Health Department teams are doing what they can to combat the spread of the coronavirus.
But despite their best efforts, the county's been unable to reach all residents with information, with preventative safety measures, definitely having trouble getting everybody tested. And we're looking at this week and last week with challenges for the COVID-19 vaccine. On top of that, there's pandemic fatigue. I know we've been doing this a long time. And as well, misinformation comes and goes, and it absolutely affects all of us.
And this is why we have you with us spending your Friday night, because we have a really important ask for all of you. The goal of this program is to recruit between 500 and 1,000 ambassadors to combat misinformation by providing communities with a trusted voice, which will be all of your voices, as a source of up-to-date COVID-19 information. So we're looking for leaders just like you who are very well connected in your community and who are willing to make a difference in the COVID-19 response.
We absolutely need you to join this effort. It saves lives. It gets us one step closer to a COVID-free community. After today's training, we'll be sending out follow-up emails that include a bunch of important information. You're going to get a CAP program interest form. That's the link, a Google form. You can reply to this email as well, and it's going to get you all the information you need so that you can help us out. There will also be a link to sign up for the weekly outreach toolkit. Hopefully a couple of you heard about this training from me. And what I had done is take that outreach toolkit, share it on my social media, and you pinged me back and said, hey, I want to help. So excited that you're here.
Yes, and so some of you may have already filled out the interest form, but for those of you who haven't, please do that, and we will add you to our master database of ambassadors. So you'll receive emails about future trainings, program updates, and more.
After you sign up for the outreach toolkit, you'll begin to receive these on a weekly basis with updated messages that are really important to addressing COVID-19 and that particularly the county has highlighted. There's going to be multilingual infographics. So if some of you have secondary languages in your network and can speak other languages, that's a really crucial way to get the information out as well. There'll be links to videos you can share through email. If you've got family email list that you bug people on, send it out through there, other social media, and then definitely use platforms like WhatsApp, WeChat, and Viber.
This is an opportunity now to open it up for questions about the ambassador program, the roles, responsibilities, and anything else that's on your mind or that Jake and I have gone over. So we'll pass it back over to Supervisor Chavez. Thanks so much.
Thank you both for being with us. And you're going to stay right there so we can get, I want them not to go away. All right, there you go. And so if there are any questions just about the program, we're going to talk about COVID testing and contact tracing and all, all of that, but just about the program itself. Are there any questions on that? Nope, we don't have any right now. I want to say thank you very much, Jake and Ellen, and please stick around if you can. That you can, that would be great. And then what I want to do is I just want to say we have Dr. Smith here, who's the Santa Clara County Chief Executive Officer, and we're blessed that he is both the executive officer but also a doctor. And we invited Dr. Fensterscheib, and he was unable to present tonight. So poor Dr. Smith is not only going to present on testing 101 and vaccine 101, but he's got a lot that he's going to be presenting us on. So I'm just really grateful to him for helping us dive in. So the first thing we're going to talk, let me just say how we're breaking this down. So Dr. Smith's going to talk about COVID 101, just to kind of the basics of what we know about COVID today. We'll see if there are any questions on that. Then we're going to go into learning more about testing and vaccinating, and more into the details of communication. So each section we're going to break up, but the first section is really going to be first on just very broadly the basics of COVID-19. And I'm going to turn it over to Dr. Smith, and thank you very much for joining us today or tonight.
Thank you, Supervisor. I'm going to try to fill in a little bit for Marty, although I obviously won't be as good as he is, but if you give me a benefit of the doubt, we'll hopefully move ahead. So I'm going to start with sharing my screen about just COVID in general. This, I hope you can see, is a very short 3-slide introduction to COVID, and we'll then show you some more from our website. So basically, COVID is a coronavirus, and coronaviruses have been around for quite some time, and they are typically the kind of virus that causes the common cold. And they are look just like the picture on the left, a sphere with a lot of little arms sticking out of it. And when the virus is introduced into the body, usually through respiratory secretions or droplets that you breathe in from the air, they go to a certain receptor that's typically in your mucous membranes in your nose. And that receptor attaches to those little knobs on the end, and the virus makes its way into the cells. It's what's called an RNA virus, meaning that it doesn't have DNA in it. It has only RNA, and that makes it challenging to develop immunizations or vaccines against it that are effective. It also has a propensity to mutate a little bit, and you've heard a lot about variants in the community. These are changes in the protein structure of those little red knobs, changes that are enough to avoid the defenses of the body, but also make the behavior of the virus different, either making it more infectious, sometimes less infectious, more resistant, less resistant, more fatal, less fatal. Lots of variants around, not enough research in the world to tell us exactly what the differences are for all the variants, because in order to identify a variant, you have to do what's called genomic studies, meaning that you isolate the RNA inside the virus and match the RNA sequencing to other parts of the virus. Very challenging virus to deal with. You can imagine, we've had the common cold for thousands of years, and we've never developed a immunization, a vaccine for the common cold. So it was really a monumental task to develop a vaccine that would be effective against a coronavirus that caused COVID. But we now have 2 that are present, and we'll talk more about those vaccines later, and we have others coming on. But just to point out how serious this virus is and the pandemic is, in the last 12 months, we've lost about 459,000 lives in the United States. And just to give you some context, that's far more, about 50% more than the total US casualties during World War II. And World War II took 4 years. So anybody who says it's not a serious infection is wrong. It's a very serious infection. Now, this is really COVID is the first respiratory pandemic that we've seen in 100 years. And it's the first and only coronavirus pandemic. The last major pandemic was a flu virus. This is a model of the flu virus that happened in 1918 and 19 in the world. It was called the Spanish flu. There was no immunity in the world among the population, meaning we had no herd immunity. And herd immunity is the percentage of people in the population that are immune to the virus. So because we had no herd immunity, the Spanish flu was very deadly. And the death chart is over there to the right, which is a pretty typical death chart for a pandemic that happens in a community that doesn't have any herd immunity. First, there's a little blip, a spike at the beginning of the infection, at the beginning of the pandemic, which represents the infection of the most susceptible, most critically ill, most frail individuals in the community. Then there's a settling period where the virus is actually spreading rapidly throughout the population. But in the flu, for example, some people who caught the flu had minimal or no symptoms, and the virus spread from one to another, typically among more healthy individuals. You'll see later that the same thing is true with COVID. Then with the Spanish flu, there's a large spike that happened in the spring of 1918. That large spike ended up killing 50 million people worldwide. And the reason for the large spike is that once the virus reaches a so-called critical mass in the population, it begins to have disastrous effects on even the healthy individuals in the community, because the more virus you're exposed to, the more severe your infection. Also in 1918, there was really a very rudimentary healthcare system. Obviously, we had no such thing as immunizations. Hospitals were places that people went in order to die. There weren't very many medications. There certainly weren't any antiviral medications, which are all benefits we now have, but a huge population death. Then it drops off a little bit from that spike, and again begins to build up, because as the human hosts passed away, obviously the volume of virus in the community decreased. But then it comes back again with a third spike, usually, and that third spike represents infections in the weakened population that have been infected previously or have had a negative impact in their socioeconomic status because of the first spike. So this is pretty typical, and this is exactly what we're seeing in COVID. Now, I wanted to show you the death slide from Santa Clara County. This is today's slide that's on our website. Sadly, we've had a total of about 1,523 deaths since the beginning of the pandemic. We were the county in the nation that had the first death. Actually, it was way back in February, so this map or graph doesn't include all of that. But you can see it's the same type of pattern. At the very beginning, a bit of a spike, then it flattens out a little bit, then it spikes back up. The gray part here represents data that's not complete at this point, because it takes a while for us to get all of the death reports. But you can see we're having a very large spike of deaths, new deaths, ranging up into the 100 range. So we're having a pretty typical response that you'd expect with no or minimal herd immunity. Now, let me go to another slide here. This shows the picture of what's going on with COVID worldwide. Worldwide, there's about 105 million cases that have been identified, and global deaths about 2.3 million. It's all over the world, all over the United States. You can see that the number of deaths in the United States is the largest number for any country, and the number of cases is the largest number for any country. Particularly on the left there, you can see the comparison of us to India. Obviously, India has a much larger population than we do in the United States. They are, I think, at 1.6 billion. We're 320 million. So we have not had a very good national response to COVID. And this is our local case graph, which shows, like we said, the first little, relatively little spike. And then we're recovering right now from a second spike. This is the number of cases, not the number of deaths, but we'll expect to go back up in the future. What I wanted to show you here is a representation of what's going to be expected in California in terms of deaths over time. This is a graph from the University of Washington, which gives predictions of deaths and cases in many locations. And this is for California. We're currently somewhere in the 27 or 37,000 range of number of deaths that have occurred in the entire state. If we were to continue in the same behavior pattern, the same social distancing, the same masking, we would expect that by July, the total number would be 85,000, so almost double. However, we have changed recently the behavior patterns when the governor raised or released or lessened the regional stay-at-home order. So that turns into the red line at the top, which suggests that we might get up into the 100,000 range of deaths in California. So we have a real disaster going on in our world. And the only way that we can deal with it effectively is with social distancing and masking. Do you want me to stop there, Supervisor, and talk about immunizations and testing after questions, or would you like me to move on?
Let's see if there are any questions just on the basics, and then we'll move on. So this is a time, if you have a question on the on COVID, the basics just of the disease itself. And if you do, this would be a time to raise your hand, and then we'll go into vaccinations and testing. So we'll talk about those two issues next. So I'll ask my team if they could call on folks who are interested just in the basics of COVID-19. If they're in other sections, I'll just ask you to wait till we get to those sections. So could the staff unmute folks?
Thank you very much, Supervisor. And we have Valentina on the line. I'll be sending you an unmute now. Please accept the unmute to present your question.
Valentina, you're still muted.
Okay, we will go on to.
Okay, I'm sorry. Can you hear me now?
We can.
Okay, so I was just wondering how, what is the plan to, besides what we're doing now to get all this out? I mean, because it's getting, like, I'm from Gilroy, and it's just people, and I hate to say this, are just dropping family members or their close community. What else can we do besides what you're teaching us?
So thank you for that, Valentina. The purpose of the program is to make sure that we have more people out in the community through their social media and through, well, really their social media and through their own networks, is getting information out. The most important thing, and we'll talk more about vaccines and testing in the next section, but what we're focusing on is making sure you have all the information you need to be able to educate the community. But we'll talk more about vaccines and testing. Jeff?
Thank you.
Thanks, Valentina.
Jeff, I'll be sending you an unmute now. Please accept the unmute to present your question.
There we go. A question about the, as the virus has mutated, and this point going forward is that, are the models that are projecting the number of deaths in cases, are they based on the increased transmissibility of the mutated virus and the severity?
Thank you, Jeff. And Dr. Smith?
The model that I just showed you does not take into effect or into account the new variants and the new transmissibility factors, which is really a concern because there's good evidence that the transmissibility requires a larger amount of immunity to create herd immunity. The more transmissibility you have, the higher percentage is required. So that will affect the number of cases and the number of deaths.
If I can have just one other question, you may cover this during the vaccination portion of it, but the people that are getting the vaccines now, I just want to clear this up. Say you get the first shot and then the second shot and you're after the 30 days or whatever, do those people still have to maintain social distancing and masking because they could, even though they themselves might not get sick, can they still carry and transmit the virus after getting vaccinated?
And Jeff, I'm gonna have Dr. Smith answer that briefly, but we are gonna dive into that a little bit more. But if you could answer that, no problem. And then we have a couple other questions that are related to the information you just presented. So Dr. Smith, could you answer Jeff's question?
Yeah, the evidence that exists in the studies that were done in order to approve the two vaccines really only shows that they succeed in reducing the severity of the disease. It's presumed that they will reduce the transmissibility of the disease, but that wasn't actually demonstrated because of the compressed study time to do the approval. One believes, we believe that because of the immunity that's created, there should not be transmissibility, but it hasn't been proven beyond a shadow of a doubt. What is true, however, though, we know that because of the variant structure, even if you've received a vaccine, you're still at risk of getting COVID, but you will get a much more contained strain, no symptoms, very few symptoms. So we still are going to recommend using masking and social distancing until at least 70% of the population is immune, at which point we're much more safe.
Thanks, Jeff. Just a couple other questions. One is that there's a general belief in the community that COVID will go down by summer, but your graph shows a scary picture. Is that true?
The belief in the community is based on the yearly experience with the flu. And, we all know that you get flu vaccines once a year. And the flu season is in the fall and winter, and then it goes away. But this is not a flu virus. It's a coronavirus. So it has expected to have a pattern more like the common cold, which happens throughout the year. So the answer is that we don't really believe that the weather or the change in seasons will change the infectivity or the presence of the virus. What we are seeing is behaviors that occur in the winter, like Christmas celebrations, Thanksgiving celebrations, New Year's celebrations, have caused spikes in the viral load, but it's not related to the weather.
And then there's a question that says, why do curves split and spread in April? And, yeah, and I think that, Jeff, that was related to some of the changes in, that you were referring to, some of the changes in.
And the case changes.
Yeah.
Because March was when we instituted, March 15th was when we instituted the stay-at-home orders, which did have a pretty dramatic effect and knocked down the level of virus in the community. So the case numbers went down and the resulting deaths went down. But then you'll remember that the state, the governor, reopened California in the beginning of the summer, which caused another immense spike because people were out gathering together and going to the beach and going to restaurants and performances. And the more contact you have, the more likely the virus is to spread and to mature. And so that's why, if you look at the history of the virus in California, it really sort of started in Santa Clara County, but because our residents were very good at maintaining a shelter-in-place mentality, we knocked down the volume of virus remarkably. But when the state opened up, the LA and Southern California area became the hotbed for the entire nation of virus.
So Jeff, we're going to take two more questions, and then what I think we'll do is to do testing and vaccination together, because I think some of the questions may blend a little bit. And so we'll go to John McKay.
I'll be sending you an unmute now. Please accept the unmute to present your question.
Okay. Hello, Supervisor Chavez. Thank you very much for hosting this again this evening. My question is how closely the county guidelines will be following the state's guidelines. In the past, we've become a little bit untethered and lagged behind the state guidelines and opportunities to move up to the next tier. Now, has that changed after this pause that we saw, where we had the complete shelter in place for, several weeks? Or will we continue to follow the same path, a little bit more conservative manner in the future?
Thank you, John.
Well, first of all, the big caveat, I'm not the public health officer, so I don't get to make that decision. But where we are right now is we're pretty much following the state pattern, and the state is changing a number of the rules and priorities as we speak. So they just came out with some new recommendations just today. So I suspect that we will be following the same pattern pretty much as the state has. There might be some relatively minor changes or differences, but pretty much expect that to be the pattern that we do in terms of reopening.
And then Jeff, I'm going to ask And just another quick question. So one question we got was how many people have tested positive for COVID-19 in our county, and I know that's over 104,000. The other question that was connected to that is, have we seen people in our county getting reinfected with COVID?
We have not seen any reinfections that are documented, but we know that the total number of positive cases is underestimated. So it's really hard to be absolutely sure. But there have been reinfections in Alameda and other Bay Area counties.
Thank you. Mike Johnson, you get the last question in this section, and then we'll go on to the next, but we'll get all your questions answered.
Mike, I will be sending you an unmute now. Please accept the unmute to present your question.
Hi, thank you for taking my question. Thank you, Dr. Smith, for the information, and Supervisor Chavez. This is a helpful meeting. Quickly, I guess what the question I'm trying to wrap my mind around in communicating to businesses. I run a business improvement district, and it continually comes up with what you're referring to as this following wave, and from the general information that's being communicated about how this following surge coming in March and April, and you're saying going into May even, what are the feasibilities of the, this dial back, dial up, dial back? Because I guess the question I'm trying to figure out how to communicate to business owners is, they're just so overwhelmed by the open, close, open, close, open, close. And it sounds like there's a heavier series coming again in a very short period of time. So if you could speak to that, I'd appreciate it. I'm sure it's a hypothetical, and you've already identified that there is a larger one coming from this next strand of the virus. Thank you.
Yeah, thanks. Dr. Smith, did you get that question?
Yeah, the question is, how do we communicate with the community and the business community, restaurants and the like, what we see in the future and whether there'll be openings and closings again. And you're right, it is sort of crystal ball approach. I can only give my opinion, and you'll get 1,000 different opinions from 10 people. But I think if you look carefully at the graphs and at the experience and at the behavior and mobility in the community, it's highly likely that there will be another spike coming in March, April area, and it will probably be larger than the current spike. The state will have to decide how they're going to deal with that. And many of the decisions, excuse me, that are being made have had sort of a political flavor to them lately. So it's hard to predict exactly how they'll respond. But I think that, excuse me, I think that it's highly likely that there will be more restrictions that come in the future. I can't imagine that when the numbers go up dramatically again, that there'll be a likelihood of expanding the reopening or easing restrictions. But again, that's just an opinion. Life could be a whole lot different. I know that many people believe that the vaccine will suddenly solve all those problems. We'll talk about it in a bit, but that's not true. So we're going to have to be vigilant at least for another year, year and a half. How the virus will proceed is really educated guess.
All right, Jeff. So Dr. Smith, I'm going to let you get some water in you. And then I think we should do testing and vaccines together because some of the questions that we're seeing are a little bit intertwined. And I'm just going to ask my staff to work with me to make sure we get to all the questions in case I miss some of them. All right, Jeff, back to you. And you're on mute in case you didn't know.
Now I'm back, I think.
Yep, you are.
So this is a testing slide you can find on our website. And I just thought I would point out that what you see here is the blue lines, blue columns, I should say, are the number of tests being done per day. The orange at the bottom is the number of positive tests. The red line is the positivity rate. You can see that we started out with relatively, actually very small numbers of tests per day. And at that time period, because there was such a low availability of test kits, and we had a lot of problems nationwide with distribution, it was pretty much impossible to discover or know how much virus was in the community. Now that we're up into the 20,000 tests a day range, or we went into that range, we have a much better idea of the positivity. You can see that there's been also a bit of a downward trend recently. It's not because we don't have slots or availability of tests. It's really because people, for some reason, are feeling that they don't need to get tested as much. That's a concern we have because testing is the only way to tell preemptively how much virus is in the community. Otherwise, we're just flying blind. So we want to increase the likelihood of people getting tested. So we want to recommend everyone should get tested. And people who are in risk situations should get tested at least twice a month. People in high risk situations like working in a store where you're having lots of contact, even though you're masked or socially distancing, probably should get tested once a week. And you can find access to our testing sites on our website. And they are simple tests. It's not the test where you put the swab deeply into your nasal pharynx. It's really just around the edge of your nose. And we're moving rapidly towards self-administered tests under observation, where you go to the testing site and you do the specimen collection yourself. So it's not painful. It's not hard. Turnaround time is now in the 1 to 2 day range. And we have obviously the opportunity to call you, notify you if you're positive, and also if you're negative, we'll send you a text. And we have case investigation and tracing for those who are positive. So still an important thing to do. Did you want to have questions about testing?
No, we'll go to vaccine, but while you're pulling up the vaccine section, let me just add one other point of the testing that I just want to really encourage you all as ambassadors to make sure we're thinking about. While we're getting people, comfortable to get vaccinated, one of the things that we will continue to need your help with is making sure that people understand that we need to keep getting tested, because that allows us to address transmission issues. One of the things that we'll make sure you get is information about, just a reminder to access, how to access testing is to go to SCC freetest.org. So if somebody calls you and they want to sign up for testing, you can send them there and help them navigate the website. It shows who's testing, where, if they need an appointment, if they can just do walk up. That's sccfreetest.org. And the other thing that I just want to add about the testing is that it's free, and and you'll see it in the chat. Jack just put it in the chat for you, but it's free to get tested, and we really want to encourage people to get testing. What that also relates to, we got a question in the chat, is are there any resources for folks who are positive, want to be tested, but need to isolate? If you need support services, we'll also send that out. I'll make sure the staff either puts a link in the chat, but we can also make available to all of the ambassadors the list of resources. But what happens is if you test positive and you need to, or you've been exposed and you need to isolate or quarantine, we have services available for folks who can't afford to pay for a hotel or have other kinds of needs. And we'll make sure those resources get out to you also. Thanks, Jeff.
Okay, I'll move on to vaccine, substituting for Dr. Finsterscheib. So as we pointed out before, the state guidance on vaccines has been changing frequently, has been very confusing, and the availability of the vaccine has been limited. There's a very complex allocation system, and within our county, there are a number of different agencies that receive vaccine. I'll try to go through that without a slide, but essentially the way the process has been set up, which is confusing, is that the federal government distributes vaccine doses directly to the Veterans Administration, which, there's a veterans hospital and outpatient in our county, and to the Indian nations. And so we do have an Indian clinic in our county. They get their supply directly from the feds. The feds then also send a supply to the states. The state of California has decided to allocate portions of their vaccine inventory to the counties directly through their county public health departments, and also to what they call MCEs, multi-county entities. In our county, that's Kaiser and Sutter or PAMF. Because these health systems have presence in multiple counties, the state allocates a central amount to them, and the allocations come on a every week basis. So in our county, if you're looking for vaccine, in the past, you had Kaiser and PAMF separately giving vaccinations, and then the county health system, Stanford, El Camino, Good Sam, regional, the community clinics, which are the FQACs like Gardner and the like, all coming from a central inventory that was managed through the county. It looks like this is going to change, and you've read probably quite a bit in the newspaper about Blue Shield being hired by the state to be a third-party administrator. The details of how this is going to work are extremely unclear, and we've been trying to get clarity from the state without success. However, the state has told us to change the allocation priorities for the vaccine, which we'll get to in a little bit. This slide gives you some idea of the very significant, large logistic problem that we're facing in our county. There are roughly 1.9 million people in the county. The vaccine can only be given to people who are 16 and over, about 1.6, 1.5 million. And we have a goal then of vaccinating 85% of the eligible population, because the individuals who are less than 16 years old count as part of the population when you're evaluating herd immunity. So 70% goal of herd immunity translates into 85% vaccination of the eligible population over 16. Everybody who gets a vaccine now has to get 2 doses. So that means in order for us to complete our goal, we need to have basically 3 million doses delivered to the county. So far, our vaccine doses have been in the 150 million or 150,000 range. This slide's a little bit dated. So you can see that the rate limiting factor for vaccination is the actual vaccine being delivered. Up until a day ago, or actually this morning, the county the state was using a phase system where phase 1A was the first group of people to get eligibility for vaccination. And that was healthcare personnel and residents of long-term care facilities, such as skilled nursing facilities and other congregate living. So the majority of the vaccine that's already been delivered has gone to a phase 1A personnel. Then in the middle of January, the state opened up vaccinations to residents or citizens who were 75 years of age and older. I should say residents who are 75 and older. Then recently, after that action, the governor, about a week later, announced that residents 65 and older were eligible. Now, just declaring somebody eligible doesn't mean you have a vaccine for them, because the vaccine delivery still was the same small numbers. Here's an example of the delivery for selected counties and the MCEs for 1 week at the end of January. You can see that we are Santa Clara County. At this particular week, we got about 20,000 doses total, 10,000 from Pfizer, about 9,000 of Moderna. Those are first doses. Not a very large number, certainly not getting us anywhere close to 3 million doses that we needed. Los Angeles obviously got the most. But a big problem you can see over here to the right was that the MCEs like Kaiser and Sutter got very small numbers. These are numbers for the entire state, not just the county. Considering that Kaiser and Sutter in our county represent about 40% of the lives in the county, they don't have enough to vaccinate even their members over 75. This is an example of our vaccine dashboard, and I'm going to show you the most recent vaccine dashboard so you can see a better representation. This is shows one of the dashboards that we have up, the new dashboard, which shows that about 180,000 individuals in the county have received one dose. And this number is broken down into those who have received one dose, which is the blue, and the green is the number of people who have received both doses. You can see we have a lot more to go and a lot of second doses to deliver. This gives you an idea of the daily, that previous slide was the cumulative amount. This is the daily amount. And right now, we're operating in the 6,000 a day, 7,000 a day range. This is just for the county medical system, VMC, and the VMC clinics and community clinics, and does not include Kaiser. We also have a link here to the demographics, remembering that, as I said, the majority of the 180,000 who have received one dose come from the healthcare population, as we point out here in this red note at the bottom. Therefore, the demographics are skewed basically to what the demographics of the healthcare population are. But as we get farther into the elder population, the 65 and older population, these numbers and demographics will normalize. And obviously that's a huge concern for us. Equity is a major priority because we know that the areas in the county that are most affected by COVID are the East San Jose area and Southern County area, and the ethnic groupings of the largest number of positive cases happen in the Latinx population and the Black African American population. So our vaccine strategy for the county part of the system is to expand access to all individuals 65 and older with mass vaccination sites, but to focus with targeted vaccination sites in the East San Jose area and South County area, and also with door-to-door mobile sites and setup sites in those areas so that we can focus on particular high-risk populations. So as you see this move forward in the future, we'll watch this very closely and make sure that the Latinx and African American populations increase in their positive vaccination rate. And if we don't see that, we will be changing our strategy in order to accomplish that, because the highest risk of death is clearly in individuals 65 and older and in Latinx populations and African American populations. So I'll go back to Marty's slides.
So Jeff, while you're grabbing the slides, just if you could just restate a little bit about where we are in the tiers, and just to share, I think one of the challenges is that the state, we think that the state and federal government may continue to make changes in the tiers and in their approach. And I think that's right, Dr. Smith, that we're just thinking, thanks, Helen, thanks, Mayor, for being with us, but that we're thinking that the that one of our challenges is really that we don't exactly know what the next group will be.
Exactly true. As a matter of fact, today, hot off the press, actually just 10 minutes ago, the state changed the rules again. There used to be, after phase 1A and 1B, a 1C group. That group has been completely eliminated. Now there's only phase 1A and phase 1B. And the qualified individuals in phase 1B have been changed dramatically. So it almost looks, and this is preliminary evaluation, so don't hold me to this, but it almost looks like phase 1B pretty much includes everybody in the state, because it's defined in such a way that it's essentially anybody who's has any contact with children or elders, anybody who is in a essential work job or has support services, anybody who works at a school or a university, anybody who works in a governmental institution, anybody who supports all of those efforts. So really, at a superficial look at the schedule, the changed schedule, without getting more information from the state, it almost looks like the only group that's not included in 1B is the homeless or houseless individuals, which obviously is crazy. So we're going to have to get some more clarity about what they mean by all of that. So should I move on, or you want to ask more questions?
I think go ahead, Jeff, and I know this section you've got a little bit more to go, and then we'll just move to everyone else. Then we'll move to the questions. I'm sorry.
This just emphasizes the parts of the county that have the highest positivity rates. And you can see, as I pointed out, the darker green are the highest positivity rates. So South County, actually Gilroy is the highest, but Morgan Hill is also pretty high, and East San Jose are the highest rates of positivity. And here are the sites throughout the county where you can get a vaccine. And we just recently opened up all of the county sites to a no wrong door model, which means all of the VMC sites and all of the sites that are supplied by the county are available to anybody who's a resident over 65. So on the right-hand side is the list of those sites. I'll just go through them. You can find this online at sccfreevax.org. But we have the health center in Gilroy, the Valley Health Center at Tully Road, the Valley Specialty Center on the VMC campus, the County of Santa Clara Berger Auditorium on Berger Drive is where the ROV is, Register of Voters, County Fairgrounds is there, Mountain View Community Center, not part of the county system, but also receiving county vaccine, and therefore also available for no wrong door is all of the Stanford Health System, regional and Good Sam hospitals, El Camino hospitals, and then part of the community center or community clinics, which also get their supply from the county and therefore also are no wrong door, Gardner, NIMS, Aki, and we've also got arrangements from Kaiser and PAMP to implement the no wrong door. So that's the list and the sites. And here's our focus groupings, where we also have partnered with Gardner Family Health Network to provide a vaccination site at Mexican Heritage Plaza. We're providing support. Hopefully we'll get that up to 2,000 or 3,000 doses a day. They're currently at about 1,000. As I mentioned in Gilroy, we're doing a site currently at San Isidro Park. We're going to be moving that to the Gilroy Community Center, and we have the mobile sites going on. So that's pretty much it with vaccine, unless you have other questions.
Yeah, thanks, Jeff. We'll go to questions. And one that Jeff, could you, well, let's start with vaccines. So one of the questions we have is that why isn't the county giving vaccination priority to groups who don't have health insurance?
The county has the priority of taking care of the safety net population, which includes everybody who's underinsured or uninsured, and they certainly are welcome at all of our clinics and the vaccination sites. The sites that I showed you are just the mass vaccination sites. All of our clinics offer vaccine to their own patients, but everybody is welcome no matter what their focus or their insurance is. And we are focusing on the communities, as I pointed out, that have greatest need and greatest risk, and typically tend to be most uninsured or underinsured, with individual outreach and mobile and pop-up sites.
Thank you. And then Anna, this is for Anna Silva. I'm gonna answer part of your question, and then I'll turn the second part over to Dr. Smith. And one of the questions is, why aren't vaccines offered at CVS or Walgreens? And one thing I just want to make an overall comment about that Dr. Smith touched on, but I just want to be really crystal clear, because all of you, we want to make sure that you can get this information out to the public. And that is that the vaccines and the vaccine availability is obviously lagging, right? Because, and I say that because what that means is that the federal government and the state government are creating partnerships with individual organizations such as CVS and Walgreens. And I'll let Dr. Smith say more about those partnerships. And then another part of the question is, why do we have only one site in Gilroy given the high need? But what I want to emphasize is that we don't have enough vaccine. The county has capacity to give out much more vaccine than is even available. So Dr. Smith, do you want to respond to that?
Yeah, first of all, I guess I wasn't clear. We have 2 sites in Gilroy, and we're working on another one. So we don't just have one. It's the Gilroy Clinic plus the community center, which used to be at the park, or a site that used to be at the park. We're also working at a expanded high volume center that'll probably initially be done with mobile. So we're focused on those communities. In terms of CVS and Walgreens, that issue is in flux at the federal level. Initially, and up until now, the federal government allocated vaccine to CVS and Walgreens specifically for residents of skilled nursing facilities. And because they didn't get enough vaccine, counties across the nation and the state had to take over the slack and begin to vaccinate residents of skilled nursing facilities and employees of skilled nursing facilities. Now the feds are talking about doing direct contracts with CVS and Walgreens for everyone. They haven't come up with a plan, or I should say they haven't publicized a plan of how that will work or how it will be accessed or how appointments will be made. We're watching that carefully. Again, as the supervisor mentions, the rate limiting step continues to be the amount of vaccine that's available.
One other point that I just wanted to raise is, and I'm going to toggle between testing and vaccine, just to remind all of you that if you go on your computer and you type in sccfreetest.org, what you'll see on that site is that you can search by city or even by a map that will tell you whether or not you need an appointment or whether or not you can drive through. And the reason is someone asked why we weren't putting the testing sites in neighborhoods, and they are all over the county. And so I would just encourage you to go on there, and especially for those of you who represent particular parts of the community. An example of that is if you go look at that right now, what you would see in Gilroy is 4 options for testing, and then that are regular, and then a pop-up clinics and other locations that are where we have service provision. So please get familiar with your website, because when someone calls you, if you can go on and look, you can help them find a location that's closest to them. As it relates to vaccines, Dr. Smith, I just can't remember the answer to this. Do we have a vaccination site being set up in Gilroy?
We have 2 already and 1 more coming.
I'm sorry, not Gilroy, I'm sorry, Morgan Hill, I apologize.
We don't have it set up yet, but we're intending to put one at the old DePaul site, but that's not set up yet.
And then, so I'm gonna go, if folks have questions on anything that we've talked about tonight, this would be the time to raise your hand. I'm gonna go through and answer some questions. So from Anthony, I heard that Asian American organizations like AKI had trouble distributing vaccines. What do you foresee are the changes or improvements for them, for especially those who live in Eastside San Jose? Well, the good news is they actually did their first vaccination clinic on the east side of San Jose today. So we'll learn more about how that's going. We have a partnership with all of our community, the Community Health Partnership, our nonprofit partners, to work with all of them to be able to vaccinate in their communities. So we're working really hard with them. And it says under Asian American demographics, is there consideration for Asian Americans in East San Jose versus West San Jose? Again, what I would say as it relates both to vaccine and testing, that there are multiple sites all over the county, but that have language and cultural competencies. And again, I would say get familiar with the website, and it'll help you make some choices in terms of where you would recommend sending people. And then we have another question saying, who is advocating to try to obtain more doses for Santa Clara County? Should we be making calls? If so, to whom? The county and all of us, including myself, have been loud and noisy both to the state and to the federal government. And the one question, Dr. Smith, that's sort of come up in different ways that I'd like you to be able to respond to is that we don't have enough vaccine. But one question is, how is the state of California giving vaccines out throughout the state? What's the process they're using?
Good question, and it's changing, and we don't have all the information we need to be able to give you a definitive answer. But What used to happen up until 2 weeks ago was that the counties got vaccine doses roughly based on population, and the MCEs got a total of 20% of what arrived at the state level, but it was distributed roughly speaking based on how many members they had, how many lives they had insured. Now the state notified us this week that the distribution system is going to change. They're hiring Blue Cross or Blue Shield to take over distribution. At this point, it looks like what they're going to do is distribute based on burn rate, so to speak. So the counties that use up the most amount of vaccine will get the most amount of vaccine the next week, which isn't necessarily a very medically sound approach, because we know that it's harder to reach certain high-risk populations, and therefore, a little slower, not slow, but a little slower. That's probably not a great way to do it. So we've been arguing and advocating, as well as all the other counties have been advocating, that that's a bad model. But at this point, the state has not changed their direction. So supposedly that's going to start in a week. We'll see how that goes. I suppose that's probably the answer to the question.
Yeah, and I'll just add one other thing. For those of you who sign up and who are on our email list, and those of you who sign up to be ambassadors, as we see opportunities for letters or phone calls, we'll let you know, because we know you care about your neighbors and your community, so we'll certainly let you know. I'm going to go to, if I could, I'm going to ask the staff if they could take questions from folks who've raised their hand, and while they're doing that, I'll look through the questions to make sure we answered all of them. And then Marie Young just reminded me that she asked why employers such as healthcare providers aren't required to test employees regularly. And I think what I wrote back is we're working closely with our staff to address this issue. And I'm wondering, Dr. Smith, and Marie, thanks for the reminder. I apologize for missing that question. I'll tell you what I was going to respond to, and then Dr. Smith, I'd love to get your thoughts. And that is that there are employers that are trying to determine whether or not legally they have the right to test their employees on an ongoing basis. And I apologize, I don't remember if I got a response yet to that question. And I don't know, Dr. Smith, if you can answer that question.
Well, healthcare employers like hospitals, clinics, doctors' offices, the recommendation is to get tested once a week. And being able to force somebody to get tested is easier than forcing them to get vaccinated. You can set typically, now these are general comments, the exact employer-employee relationship is determinative. So some employers have unionized workers, some non-unionized, some contract workers, some typical employees, but usually the employer has the ability to make it a condition of work that they get vaccinated tested if it's critical in the performance of their function. So probably it'd be hard to force a clerk or a secretary to get tested if they don't have a lot of exposure to the public. But certainly healthcare workers, yes. In terms of forcing people to be vaccinated, that's another issue. Most of the time, people have the right to refuse medical interventions. and it's hard to force them to be vaccinated unless there's an extreme showing of risk to the population. So that's where we're at.
Thank you. Mike, and then Myra, Jenny, and Leanna. And then I'll come back to the written questions. And Deborah, I saw yours as the first one, so I'm going to ask Dr. Smith when he gets a chance to take a look at it. Go ahead, Mike.
Mike, I'll be sending you an unmute. Please accept the unmute.
Hi, it's Mike. Thanks again. Cindy, I have a question, and I'm not sure who the channel might be with regards to social media and distribution of information to our community with regards to sharing social media posts to identify, you know, the packages you sent us with the images and, you know, kind of, you know, artwork that talks about things. Is there a way that we can get that information in addition to a hyperlink to an actual site that drills down into more specific information on it, so it's easier for us to disperse if you're looking for vaccine signups or locations? You know, click here, here's the link, go here. If you know, if you're looking for testing, next available testing in your area, click here, go there, rather than just a picture that says something, but really then
It doesn't have a hyperlink in it. Yeah, Mike, when we get to the next section, we'll start with that.
Thanks.
Yeah, thanks. That's helpful. Myra?
Myra, I've sent you over the request to unmute. You can unmute yourself.
Okay. My question is, if you've already received the immunization, then it's advisable to go ahead and continue to get tested, because I've had that question and with our elderly up in the foothills, and I didn't know the answer, and I'm learning today, because I thought once you get the immunization, why go get tested if you've got maybe the virus in you, you know? And so this is very helpful what I'm going through, because I get that question a lot. The other thing is, and I'm very impressed. I went and got my immunization at Tully Clinic, and it was a beautiful process, the way what it went through, and very efficient. Versus now I've seen and heard some of my clients that they have to stand in line at the Mexican Heritage, and we're talking about, you know, people in their 60s and 70s, and so cold. I'm wondering, is there a site? I didn't see something that I recognized up in the foothills area for immunizations. And if not, if you're considering or thinking of still doing it, I do understand there's a shortage of immunizations, but I'm open to receive and welcome if we want to put a site up there for immunizations.
Thank you, Myra. And the short answer is we're going to be looking to continue to expand sites as more vaccine becomes available. And the sites are different. The Mexican Heritage site, you don't need a appointment, so you go early and then you come back later in the day when you have your wristband. The site at the fairgrounds is one that you can make an appointment for. So again, what I would suggest is when you go on the site, and frankly, if you see locations that have nice big footprints in them, feel free to email those to us, because you will receive emails from us if you've signed up to come today. And then, so thanks for that, Myra. And then I just wanted to say, someone asked when we have another Spanish training. We've done one for Spanish speaking ambassadors, and we have a follow-up to that Spanish speaking program tomorrow. And I'll just ask the staff if they can put the contact information in the chat, so anybody who wants to come to that training, we can send them a link to get it in Spanish. And tomorrow's really going to be answering community questions, so people know how to do that more fluently. Jenny. Jenny, you want to unmute yourself? Or Victor, if you could help her.
Jenny? Jenny, we've sent the request for you to unmute. If you could just accept it.
Maybe, yeah, we'll go to Leanna and then come back to Jenny. She's available.
Okay, Liana, I've sent over the request for you to unmute. If you could please accept the unmute.
Thank you, Supervisor Chavez and Dr. Smith, for the presentation today. I found it very, very informative. While the presentation was going on, a friend contacted me to share her experience getting the vaccine today. She was very complimentary to the entire process, but wrote specifically to share her concern that is aligned with Myra's, that the time online with an appointment was 1 hour and 50 minutes. And when we're talking about a population that's age 65 and older, standing in line for 1 hour and 50 minutes is really not tenable for many of them. And so my question, I think, is aligned with Myra's, although the location was actually in the North Valley. You know, what can be done to increase capacity or more sites or something so that people are not waiting online for so long? And thank you again.
Yeah, and we will absolutely, as we can, we're going to keep trying to get more sites available. So thank you for that.
Maybe I can jump in on that a little bit.
Sure.
As you pointed out, Supervisor, the Mexican Heritage Plaza has a strategy of no appointments, but they line up for wristbands and then come back during their time period.
I just muted. It wouldn't do it before. Okay.
Oh, there you go, Jenny. We can hear you. Wait, Jenny, if you could just wait 1 minute, we'll come right back to you. Go ahead, Dr. Smith.
We're trying to expand the capacity at the Mexican Heritage Plaza. We're waiting right now for Gardner to give us a plan to open 7 days a week. And during at least part of that, we've suggested that we not do the wristband because that works for some people, but it doesn't work for everybody. So it might be better to have appointments structured for at least some of the time period. And we're trying to build out, as you said, as many sites as possible with as much infrastructure as possible, presuming we're going to get the vaccine. But if we don't get the vaccine, we'll scale back the appointments because if we wait until we get vaccine before we start building the sites, we'll be way behind. So we'll have the sites built, the staffing arranged, the locations chosen, and we'll scale up or scale down based on how much vaccine we get, focusing primarily on the high-risk populations and our safety net populations as the ones that will never be eliminated from the process.
Thank you. And then Alex put to all panelists the ambassadors training link in Spanish for tomorrow. So if you look in your chat, you'll see Alex put it in there. And we'll go, Jenny, we're going to go to you. Want to unmute yourself?
Jenny, we've sent over the request. If you could please accept the request. Oh.
Go ahead, try again, Jenny. One more time. We saw it unmute.
I had unmuted.
There you go. There you go, Jenny.
There you go. We can hear you now, Jenny.
Thanks. My question is, you had mentioned CERT earlier, the Community Emergency Response Team. Is there any type of coordination between that organization and the county? We are trained actually to take the place of county personnel in the event of either a disaster or something that has to be handled so that they can go out and do what they have to do. I mean, we would not be, pardon me, diagnosing or anything, but we could help with the staffing, with record keeping, whatever. That's what we're trained for.
Yeah, you know, Jenny, I'm so glad you raised it. You're like the second person in the last 24 hours, and Jeff Levine also put it in the chat. And so I think what we'll do is we have a gentleman by the name of Gary Hersig that is Gary Hersig and Dr. Smith, I'm forgetting, and Dana Reed. Dana. So we'll make sure we connect with them. And
yeah, we do have a relationship between the EOC and the search teams across the county. We have not asked the CERT teams to vaccinate or find vaccinators at this point, but as we expand, we non-clinical jobs will be assigned as needed. So yes, we've got those relationships.
yeah, and Jenny, let me just add one thing that Steve Preminger reminded me is that we're starting a program with volunteers to be able to call seniors to help them sign up to get their vaccine. And the CERT team in Cupertino helped staff those phone banks. So thanks for the reminder, because we have so many CERT volunteers countywide. There's more we can do with them. So thank you for that. We're going to now go to Poonam.
Yeah, thank you, Dr. Smith and Supervisor Chavez. That's a really, really good presentation. My question is, regarding the agricultural workers and the homeless or the unhoused folks in Gilroy, considering how high the positivity rate is out there. Are we setting vaccination sites at locations where they are located primarily, like at the at the farms, or maybe where the homeless folks are? Are there homeless shelters where the vaccination sites are being set up, or do they have to all go to the park or Valley Health Care Center to get vaccinated? So that was question one. And second one was, what is the best way to even disperse all of this communication to them? Considering that not everybody has access to social media platforms or Facebook or emails or anything like that, what is the best way that we as a community can disperse this information to them?
The first answer to the first question with regard to the homeless or houseless, we have a Valley Healthcare homeless program run through the Valley Health System that sends a backpack team out into homeless encampments and has the availability of offering vaccine. And we've been trying to vaccine on a one-to-one basis in that way. Obviously, people who are homeless also have access to our mass vaccination sites or our clinic sites, but we feel it's important to do the outreach directly. So that's that group. In terms of the agricultural workers, until today, they weren't in the appropriate list unless they were 65 or older. But now, as of today, the state has changed the priorities. So we'll be doing more outreach into the agricultural worker group.
Yeah, thank you for the question. And our backpack medicine team they're just going to start doing reporting, I think, Dr. Smith, on Tuesday, of the outreach that they've been able to accomplish on the vaccines. They're reporting now on testing, but not yet on vaccinations.
Right.
Yeah. So we'll have more for you on that. And then, one other thing someone just said, I heard they're not respecting times of appointments. For example, if someone has an appointment at 9, they come at 4. I will say that one of the things that we're finding is that sometimes when people have their appointments at 3, they come at 9. So, I don't know exactly how to deal with that, but if you guys have ideas, feel free to get them to us. I'm going to take one more question, and then I'm going to ask our last group to present, because they're going to answer some of the questions about how to do communication. And one thing I would say is I recognize a lot of names are folks who went to our last trainings, which I really appreciate, because I feel like I could listen to this. I learn something new every single time I hear it. But one thing I wanted to just, on the map on the testing site on the dashboard, yeah, I'm gonna ask the staff if they can navigate both the vaccine site as well as a testing site live, just so everybody can see it. Tom, that's a really good question. It took me a minute to find it as well. But what we'll do is let me just say, I wanna look and see about, one question, Dr. Smith, is about pregnant women getting the vaccine. And, you know, I'm not, could you respond a little bit to that? I think you did already, but just because it's come up again.
Yes, pregnant women should get the vaccine. It's safe for them.
And then one last thing is folks have asked once you get vaccinated, if you should continue getting tested. And I know that I've heard Dr. Fensterscheib say yes, that it's important to still get tested. Dr. Smith, do you agree or?
Yes, until we get sufficient herd immunity that we start seeing eradication of the pandemic, we should still keep getting tested.
And we are asking people to continue to wear their masks and to stay socially distanced, in part because there's a lot we still don't know about how the vaccine behaves, and we're going to want to keep people as safe as possible. And then, you know, we're getting a lot of good feedback about making sure we have testing and vaccination sites all over the county, and when we can, to start doing drive-through vaccination sites as well. I think we want to do that. So I'm going to turn it over then to my team, to Jack and Alex. Are you doing the presentation, or Kathy?
Yes, Supervisor.
Oh, great.
Okay, let me pull up.
Hello, Jack.
No, it's Alex. I'll share screen.
Oh, I see Jack. I don't see Alex. All right, there we go.
Here we go. Oh, let me turn on my video. I apologize. Start video. Okay, great. Thank you, Supervisor. Let me look down here. Here's where the camera is. So can you all see this? Is this visible?
Yes.
Okay, great. Full screen. Okay, thank you so much, Supervisor. So hi, everyone. My name is Alex Lynn, and I'm part of the CAP team. My colleague, Jack McGovern, and I will be giving a brief presentation on COVID-19 communications. I will begin with top-line messages, and then Jack will go over our weekly outreach toolkit and social media. So as our esteemed co-leads, Mayor Kamei and Jake touched on earlier, our community is experiencing information overload, including, unfortunately, a lot of misinformation. And all of this is resulting in pandemic fatigue. To combat this, we're providing top-line messages of the week for you to emphasize in your information dissemination and outreach. Oftentimes, these messages will be the same from week to week, but they do change based on what is happening in the community with vaccine administration, case rates, et cetera, other factors as well. Of course, our top-line messages right now are get vaccinated by going directly to your healthcare provider or by accessing sccfreevax.org, get tested by going to your healthcare provider or by accessing sccfreetest.org, and reduce your risk by masking up, staying more than 6 feet away from others, and staying home as much as you can. The infographic on the left is one of many that are available on the County Public Health social media, as well as the CAP social media accounts, which Jack will be going over. As you heard today from Dr. Smith, there is a lot of information to disseminate related to vaccines, but here are our top messages. That it is safe, that we will get the shot when it's our time, that the vaccine is not an excuse to drop our guard, stop wearing masks, or stop social distancing. It will take time for the vaccine's widespread effect to take effect. The top questions in the community right now are, understandably, whose turn is it now, and when is it my turn? Currently eligible for vaccination are those in Phase 1A, healthcare personnel and long-term care facility residents, and Phase 1B, Tier 1 partial, county residents 65 and older. As mentioned earlier, the county health system and several other health systems have implemented a no wrong door system where we are providing COVID-19 vaccines to any county residents 65 and older, regardless of their healthcare provider or insurance. For up-to-date information about vaccines or to schedule a vaccination appointment, refer people to sccfreevax.org or refer them to 211. As a reminder, vaccine availability and eligibility are changing rapidly, and all vaccinations are by appointment only at this time. The county will update sccfreevax.org regularly as new information becomes available. I know you've heard us repeat the URLs many times during today's session. It is intentional. Yesterday, our county public health department launched a new data dashboard with information about vaccine administration to county residents, including the total number of residents vaccinated to date. You can view vaccination information by race and ethnicity, gender, age, by date, or overall. And let me, before we go to the next slide, let me minimize this one. And let me pull up testing site. So here, actually, I'll need to pause and ask now, how visible is this? Is this zoomed out, zoomed in?
Zoom in a little bit, Alex.
Zoom in a little bit. It's now at 100%. Is this better?
It's perfect. Thank you.
Okay, great. Thank you, Victor. So this is the sccfreetest.org website. They'll take you directly here. As you see, it's available in English, in Chinese, in Spanish, in Vietnamese, and Tagalog. And right here, you can click here. It's schedule an appointment today, and it'll take you directly to this, the Fulgent website. And when you get to this Fulgent website, up here it's English, Spanish, Vietnamese, and Chinese. You can make an appointment. It'll take you through the process. There are frequently asked questions here. And let me close that tab out. So continuing on, again, sccfreetest.org. As you scroll down, you can search by city, near you, by date, by provider, or see all testing sites. So let's say we continue down here and we click Morgan Hill. It takes us straight down to the Morgan Hill part of the page. And here are specific testing sites available in Morgan Hill and how you can schedule an appointment. And this is what I did earlier. Yeah, click Morgan Hill. So let me close this and close this. So this page is sccfreevax.org. And as you can see, it's also available in Chinese, Spanish, Vietnamese, and Tagalog. And here's where we are now. And as Dr. Smith mentioned earlier, this may be being updated soon, but this is where we are currently. And there are links here, inventory dashboard, demographic dashboard, who's currently eligible. So you click, it'll take you down to where it is. There are also frequently asked questions. Learn more. Here are the recent press releases from the county. And that's on this site. And you can see at the very bottom when it was last updated, in case you're ever wondering. And that's this site. And now let me go back to here. And now I'm going to pass it over to my colleague, Jack McGovern. Jack?
Thanks, Alex. Hello, everyone. My name is Jack McGovern, and I am one of the other co-leads for the Community Ambassador Program. I will be walking us through the county's support resources, the outreach toolkit, and the Community Ambassadors Program's social media. First, we'll go over the support resources the county has, which we ask you to share with your friends and neighbors. On this slide, you'll see a full list of websites, phone numbers, and emails available to support county residents, which Supervisor Chavez referenced earlier in the training. So when you go spreading information to your community through the Ambassadors Program, you will be able to share with them these resources. We have COVID-19 information, including sccfreetest.com and sccfreevax.com. We have resources for workers and businesses. For many of our ambassadors, this section is key. If you know a business owner who is struggling, please send them these numbers and websites. We'll be able to get them some help. We have support resources on there as well, including our COVID-19 support team, Second Harvest Food Bank. The COVID-19 support team is the one that helps those who need help isolating or quarantining by providing housing, transportation, meals, or more. We'll be sure to send all this information out to you right after this call so you have it readily available to give to your friends and neighbors. Next slide, please. Now we'll go over the outreach toolkit that's been referenced a lot in this training. The outreach toolkit is a weekly newsletter sent out to each of our ambassadors over email. It's been prepared by the Emergency Operations Center and contains multiple posts regarding the top line messaging for the week. After this call, you will be sent a link to sign up for the toolkit. Please sign up. Also, if you do not receive the toolkit next week, please make sure to check your spam folder and email us at sccap@bos.scc.gov.org. Again, that email will be sent out, so you don't have to write that down or remember it. So if we can put the toolkit on the screen, please, in the web browser.
My apologies. Let me locate it one moment.
Okay, give us a second here, folks.
Here it is. Okay.
Here we go. So this is the outreach toolkit. This is how you see it in the browser format. So when you get the email, you can click right there at the top, the link to take you to the browser. But as you can see, as you scroll down, there are multiple templates of social media posts for you to share. This week, the top line messaging is about case rates, vaccines, and safety during the Super Bowl. The toolkit has templates in Spanish, Vietnamese, and other languages as well. If you scroll down a little bit there, Alex, please, yeah, you can see that you can click on the Spanish version, traditional Chinese as well, and it'll take you to links in other languages so you can post for different communities who are trying to reach. So if you can access the toolkit in your web browser, which you do again by clicking the view this email in your browser at the top of the email, you can then access past issues of the toolkit right there in the top left corner. This will take you to templates in newsletters from previous weeks. So the reason we're showing you all this and why we're sending it out to you is we want to keep our messaging very simple, to the point, and repeat them as many times as possible to help augment our societal behavior. You've heard us repeat over and over again, SCC free vax, SCC free test, the outreach toolkit. We're really trying to get that repetitive message out there and about so people know and it sticks in their brains. Feel free to ask us any questions about the toolkit after this presentation. Finally, we'll go over the CAP social media pages. So if we can go to that last slide, please. Perfect. So again, this is the outreach toolkit right there at the top. And perfect. So the Santa Clara County Community Ambassadors Program, Facebook, Twitter, Instagram, and YouTube channel are all live now. So please, after this call, go like and follow us on all platforms to stay updated on all things CAP. I'll now go through the sites to make you familiar with them. So here, if we could go to our Facebook page, please. Here you can find the posts from the Outreach Toolkit, which we'll post on our Facebook page, along with updates on upcoming trainings. So you can see that we have posts and videos. We have lots of different things for you to share right off the page. Perfect. Now, if we could go to the CAP Twitter page, please. This is the Community Ambassadors Twitter page. Here you'll find updates from the CAP team, the County Public Health Department, the California State Public Health Department, and other pertinent information related to COVID-19. So as you can see, we have posts, retweets from the 49ers about the upcoming Levi Stadium. We have posts from Supervisor Chavez. So please follow us on Twitter to get some good information as well. Next, please we'll go to the Instagram page. Now, if you have Instagram, you can follow us at SCC_CAP. Similar to our Twitter page, we'll post from the County Outreach Toolkit and have other updates related to the county. You can follow our stories on Instagram. You can see all of our different posts there if you want to scroll down. And feel free to share these, take them. We want you to be the experts in your communities. Finally, we'll go to the Community Ambassador YouTube channel. Here you have the YouTube channel where you'll find past recordings of trainings that we've done in Spanish, Vietnamese, and our supplemental training on behavioral health. As we move forward through the program, we're going to update this with each training, so you'll be able to go back, share them, watch them, get any information via video that you may have missed or someone is interested in. So if we could, again, Alex, please go back to the last slide. So once again, all of these links will be sent to you via email after this training. The Facebook page, Twitter, Instagram, YouTube channel, the Outreach Toolkit, and we'll keep making sure with that repetitive messaging that you're able to see all this information. With that, I will pass it back to Supervisor Chavez to close this out and take any final questions. Supervisor Chavez.
Thank you very much. You guys did a good job. One thing I wanted to just raise is that Mike raised a really good point about making sure that we can put hyperlinks in our information so it's easy for people to use, and we'll keep doing that. There are a number of questions that I know folks have that we didn't yet answer. I'll see if there anybody who wants to raise their hand while we go. Deborah, I want to make sure we got to your question about you read the New York Times that getting vaccines helps you not die, but not necessarily help you not get sick. So you can still be asymptomatic, a carrier following the vaccination, and you should still wear a mask and social distance for the foreseeable future. Can you comment on whether or not there's one vaccine that is better than the other? Dr. Smith, could you answer that question?
Well, first of all, the message is correct. Just getting the vaccine, the only documented finding in the studies was that it prevents you from dying and tends to mute the type of infection you have, so you might not be hospitalized. There's no clear evidence that it totally prevents you from spreading the disease once you get infected. So you should still be using your mask and social distancing, even if you've been vaccinated. In terms of which vaccine is best, they both Moderna and Pfizer use the same technology, and there's no significant difference. So there's no reason to prefer one over the other. The vaccines that are upcoming use different technology, and the studies are still being done at this point in terms of comparison of the efficacy. So we won't know about those for a while.
And then let me just see. One question that we got is, will we be allowed to travel more than 150 miles in and out of the county without having to quarantine after we are vaccinated?
At this point, no.
Thank you. And then one person asked, I think we responded to this, but I just want to make sure that the state website doesn't have any new guidelines, and will they be announced in public soon? I don't know if we, Dr. Smith, do you know the answer to that?
They sent a email to the public health officers telling about the new guidelines and said that they would have it up on their website soon. So I think I would just keep checking back with the state website for changes.
Thank you. And a number of folks have asked us, about advocacy. And again, I just want to say, if you're on this group chat, as we learn and think about more ways to engage you, we will absolutely do that, including advocacy, particularly if you all are comfortable with that. And then Emily, does the emergency use authorization affect the option of mandatory vaccination? I'm not sure I entirely understand that question, but Dr. Smith, do you want to take a crack at it?
Yeah, the emergency youth authorization just is a statement from the FDA that allows the use of the vaccine. Gosh, I'm sorry. Allows the use of the vaccine without a full testing schedule. And it doesn't really affect the ability to force people to be vaccinated. That's a state and local law. But in general, I think it's unlikely that people can be forced to be vaccinated except under special circumstances.
Denise, could you go to Denise Perales? I saw her hand up a minute ago. Oh, but it went down. Oh, it's in the chat now. Okay, Denise, I gotcha. I'm wondering if you only receive the first dose of a vaccine and have a reaction, are you at least a little better than someone who never received any vaccine at all?
Yes, you are. And depending on the seriousness of your reaction, you're probably appropriate to get a second dose. If you have anaphylaxis, which is, swelling of the breathing tubes and, severe shortness of breath, you should not get the second dose. But if you had just a mild reaction like a skin rash or something like that, you probably should get the second dose.
And then if you have a healthcare provider, should you schedule your appointment through them or through the website? And what I would just say is, if you go to our website, sccfreevax.org, and you see your provider, I'm going to encourage people to go to their provider. And, obviously, if you can't get in there and you want to go to the county, you should do it. But part of the reason, and Dr. Smith, you should tell me what you think about this, but part of the reason I want people to go to their providers is I think the more pressure we're putting on providers, the more pressure the providers put on the state and the federal government, and the more we create that sense of urgency. I feel like people know we need to be urgent, but I want everybody in on that. And so thanks, Jeff. And if you see what Dr. Smith just put up here, you can actually find your provider on here. And Anthony just wrote, I hesitated going to Kaiser because there's so many hoops to jump through. And yeah, I appreciate that. And, the goal is to make sure that we're using all the pathways available so we can get as many people to get vaccine. Jeff, do you want to just talk a little bit about what you're showing people?
Yeah, this is what you'll see when you go to SCC freevax.org. The eligibility list, and then a list of the major providers with a link over here to the right about scheduling an appointment. The county system is third down, and you can schedule in Spanish, Vietnamese, Chinese. Then it'll tell you who's going to be eligible next, something about safety, logistics, timeline, description of how vaccine comes into the county, and a bunch of references and reference material. So in terms of scheduling your appointment, you should schedule through your provider. Some people have a provider who's a private physician and a different type of insurance structure. You should contact your provider and ask them for direction. You're welcome at the county system in any respect if you're 65 or older.
Thank you. And one question is, if Johnson & Johnson gets emergency use approval from the FDA, would Santa Clara County be open to providing it? And I'll just say yes, but Jeff, do you have a different take on that?
No, we get the vaccine from the state and the feds, and if they send us Johnson & Johnson, we'll give it.
And what are we doing to ensure that people who receive the vaccine from Santa Clara County are from our county?
We ask for documentation of age and residence at the appointments slip or appointment online, and also when they show up for vaccine. Now, of course, we have challenges with people not telling the truth, but we are vigorous about assuring that they're residents of the county. That being said, people who are undocumented are welcome to bring a card from the consulate or any other evidence of residence in the county.
Thank you. And Linda asked, can someone do testing at different locations or different days, on different days, or should you stay with one testing site? Linda, go to whichever testing site's most convenient for you. And then how do we manage the leftover vaccine? We lose those vaccines. Do you have a plan in place for anything left over?
Yes, we have a wastage policy, particularly important with the Pfizer vaccine because it has to be stored at minus 70 degrees. So if vaccine has been thawed and say somebody missed their appointment or they decided they don't want the vaccine, we have a protocol for finding other people that would be eligible for that vaccine. We do not, well, we try never to let any vaccine dosages go to waste. I can't say we're 100% successful. There's been a handful of wasted vaccine dosage based on not being able to find somebody who qualifies, but we have a whole system and a list of people to call.
And then Joe asks, are the county providers proactively scheduling the second shot, or is that up to the individual? In most instances, we're trying not to let you leave the facility until you have your second appointment.
Right.
And then Barbara asks, one of the questions is the vaccine, if we are allergic to PEG, how we can respond if we do not know what is that, or do not have regular visit to the doctor. If we're helping to fill out the information, who can explain that?
PEG is a carrier that's used in some vaccines. It's not used in these particular vaccines. The technology for these vaccines is really quite interesting. It's the first time we've ever had mRNA technology where basically instead of having antigen or denatured virus inserted or injected into yourself, they inject a section of the messenger RNA from the virus, and then our body creates the proteins that then the immune system reacts to. So if you have an allergy to something, just make sure that you let the provider know when you're getting the shot. But it's very safe, and there's no animal products, no albumin, no eggs, nothing like that.
Thank you. And then Dr. Smith, we've gotten a couple questions about the Johnson & Johnson vaccine. And one question is, with its 66% efficacy, how do you know if the vaccine works in your body or not?
Well, that's probably a question I can't give you a great answer to. It's actually more than 60% efficacy at this point, but it hasn't been approved yet. So there's still studies going on. However, the general belief is that any immunity is better than none, and that we're talking about relatively small changes in the degree of efficacy. So if you get offered any vaccine, you should take it.
And we got a couple of questions from Suman, and I'm sorry, I'm just catching up with you about, when are events going to be opening up, and what do we think? When do we think that answer is? And what I was going to say is, Dr. Smith, you then said something like we're waiting for 1.5 years. And what I would just say is, I honestly do not believe we know the answer to that question. And Dr. Smith, I don't know if you want to respond to that.
Yeah, I'm a bit of a Donnie Downer on this issue.
Really is. He really.
So this is the part of the discussion you probably shouldn't listen to. I don't have as much confidence in the behavior. I like the vaccine. I think it's good, but the major factor that causes the spread is the mobility and behavior of people. And even though we're doing really good in our county, there's sections of the California that aren't doing good, and there's sections of the country that are doing really poorly. So I don't have as great a positive outlook, but you should listen to Dr. Fauci, who's very positive and believes that we might be able to get back to something normal in the fall.
So, so we have a couple of questions that fall into kind of a bigger category of questions, such as what happens to the group of weak immune systems, people who have like diabetes and cancer, can they get vaccinated? And then someone else says, a neighbor asked if the vaccine is safe for people with MS, neuropathy. She has spinal surgery, and her doctor said the vaccine is safer than getting COVID, but she asked me to get more information in terms of those categories.
It's very, very safe, and safe for all of those things that were mentioned. There are some fairly rare, well, very rare immune diseases where there's question marks, but nothing that, your audience would typically have been experiencing with. So I would recommend it for anybody who has any pre-existing condition, because it's better to be protected than not protected.
And then Carlos asked, for homeless or houseless folks who've lost their identifications or they've been stolen, what's the best way for them to prove residency? For example, they're RV residents or they live in their vehicles. Carlos, we are asking people, but if they don't have proof, we're not turning people away.
Right.
Yeah, and then David Grady points out this new designation for 1B, does it include people with disabilities? Does it include people with disabilities, which is another high-risk group? I'm not sure I know the answer to that.
Well, I would say, since the data or the directive just came out from the state, I don't want to say anything authoritatively because it's a little unclear, but I would think that it would, yes.
So Blue Shield is taking over the state, but it doesn't have relationships with PAMP. And how will that work, since PAMP is a large part of the our service providers? And what I would just say is that Blue Shield, whoever takes over the state, is going to have to work with everybody. That's part of going to be their obligation. We're not super excited about it, so I'm not saying this like, yay, yay that they have a third-party administrator. We really concerned and want to make sure that the counties across the state still have access to the vaccine, because as you've heard and as you've learned, you know, we feel like we're much more flexible and much more responsive to community need than anyone else. So, you know, we'll you know, we are going to do our very best to work with the state, but the state has an obligation, and the third-party administrator has an obligation to work with everybody. Another question that Clive asked is, can we get the vaccination sites to the list based on what vaccines they're offering?
Well, I think the short answer to that is not really, because they don't consistently have the same vaccine. We send out the dosages based on what we have in the inventory. And so sometimes it's Pfizer, sometimes it's Moderna. Typically, the smaller locations have Moderna. The more centralized, larger locations have Pfizer, because the Pfizer storage problem is very difficult. And so you have to use it right after you thaw it. And it requires a special refrigerator. So that's one way of getting a sense of it, but it's not, we just send what we have is basically what it boils down to.
Thank you. And then I'm going to take a couple more questions, and then I'm going to ask for our final poll for our staff, just to give them a warning there. And one is, do we know why Black and brown communities are behind whites and Asians in terms of getting the vaccine? Have we identified why, and taking into consideration why they were harder hit? Dr. Smith, do you want to take that one?
Well, I think in terms of the vaccination, part of the problem is that the demographics currently represent a lot of the 1A population, which is healthcare workers. And that's not the ethnic distribution demographics in healthcare workers in the county is not the same as the general distribution of residents. However, we don't really know why those populations are most hard hit. There's lots of theories. I personally don't believe it has anything to do with genetics. I think it's probably based on issues of opportunity related to the opportunity to stay at home and shelter in place, and jobs, types of jobs, and living situation with multiple families living in one location. But there's many other theories. It's probably a combination of factors.
Thank you. Dr. Smith, do you know, can you give an update on the California Notify program, the phone app? Do you know anything about that?
It's connected to My Turn, which is the California system that's being implemented. I don't know much about it. All I know is that it was sort of put together pretty quickly, and there's lots of concerns about reliability.
So one question is, do we know when we're going to have an outdoor vaccinating kind of drive-through site? And I'll just say that we have a number of partners across the state that are doing drive-throughs, and we're learning from them about how to do that safely, right, and well. And one of the things that we know is that we need really significant sized parking lots. So that's, as we're expanding into new locations, I know we're looking for those large parking lots. I will also say that I know that some of the vaccines may be easier to use in a drive-up environment. And so we're looking at that as well. So I only have you all for a few more minutes. I just want to say I'm really excited that we had 80 people stay with us. We got as high as 111, but that just tells you how much interest and excitement that there is in this topic, and we really appreciate it. Can I ask the staff to put up the last poll? And if you don't mind, could folks just fill this out for us? And this really is, we want to know how you rank your understanding of COVID-19. And then for those of you who are new, who want to help out, we're looking to see how much time you can spend helping us. And for those of you who joined us before, now that you've had a chance to sort of learn more, one, we want to encourage you to keep communicating with the public and with your publics and making sure they know what you're thinking. But also, we want to make sure if there's anybody in your community you think we could engage or invite to participate, we'd really love to do that. While people are filling out the poll, also, Dr. Smith, we have another question. If somebody got their first vaccine, but then they had an infection, are they allowed to take antibiotics in between the vaccinations?
If it's a bacterial infection that they're getting antibiotics for, yeah, they're allowed to take it, and it doesn't necessarily interfere. If it's a viral infection, it depends on the type of virus.
Thank you. And Victor, thank you very much for the link on the social determinants of health in the question and answer section. I think that's actually a very good framework. And so with that, I just want to really say thank you. And I'm just going to let people keep responding to that. We're at 50, so anybody else who can chime in, we want to learn from you. And yes, you have to wait your turn. And will you be notified by your healthcare provider? We have actually, our staff has put in a health order that makes they're supposed to do that. But the reality is that we're going to learn more from the state every week, and we'll keep checking in with you. And frankly, when you get these emails that are sent to you, check our Facebook and all of those other things. You'll learn more as we do about when people are available to get the vaccine. So with that, I'm going to look real quick. We're still some people responding. And how can 40-ish people get the vaccines that were wasted, as mentioned before? Well, we're not wasting them. We're signing people up. And I think the way, Mark, that we're doing that is with people who have high exposure risk is who's getting in that call line, I think, for when we have extra vaccines. So that is irrespective of age. So with that, Clive, thank you. And thank all of you for your feedback. And let me see, Nancy, I want to make sure I respond to everybody's questions. All right, so go ahead and we'll stop that. Let's see what we got. We have more people who are advanced and intermediate. We still have some folks that are feeling like it's a little basic. We'll keep working with you. And thank you very, very much for the hours that you can spend with us. And I'm going to hold people accountable. Please think about the additional ambassadors. I will tell you about one more training we're going to be doing. We're partnering with the County Office of Ed. Someone asked earlier about schools, and I apologize, I meant to type this in, but we'll be working with the County Office of Education to do an update on the schools as we learn more about the president's plans for opening schools in the near future. All right, thank you everybody very much. Dr. Smith, thank you for being a one-man band, and Jack and Alex and Kathy and Victor for all the good work, and for all of you who hung out with us on a Friday night. We deeply, deeply, deeply appreciate it. And we'll get the slides out to you as Dr. Smith gets them to us. All right. Thank you. Everybody have a great night. I really appreciate you. Wear your masks, wash your hands, don't touch your face, and be safe.
Thanks, everyone.
Thanks, Jeff.